Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, they're pretty low. Coffee, wine, iced tea, my favorite, those start off at a low pH. And if you're drinking a lot of that, you are forcing that critical pH to drop and your teeth are dissolving. Hear this all the time of practitioners mentioning this to their patient, taking them off of mouthwash, and 6 to 12 days later, seeing a drop in blood pressure and sometimes getting off the high blood pressure medication. This is a crime. This should not be happening. Why not take advantage of that wonderful wellness of being able to breathe through your nose for the 7 to 8 hours that you're just sitting there doing nothing? That's what mouth taping really is. Everyone should mouth tape. I want to force all that air in and out so my CO2, O2 levels are perfect and my HRV levels go up, my respiratory rate drops, my resting heart rate drops when I mouth tape.
Dr. B, it's great to connect with you again. A lot has happened in both our worlds since our last conversation. It's been a number of years, but I want to jump right in, and we may have some overlap of our last chat, but we got a lot of new stuff to get into. And I think a good top-down approach, keeping things really general to start, is talking about the health of the oral cavity as a whole and the connection of that to the rest of the body.
No, Jesse, great to see you again. It's been a few years, and you're right. There has been there's a lot of new information. The deeper you dig in oral health, the more pops up, and this happens almost weekly to me. I see a new study, and it's not necessarily a new study, and it just hasn't been discussed and talked about, and especially in how it connects to the rest of the body. So thanks for having me on the show. Yeah, the oral systemic connection, still a very viable, very exciting topic. What we call it on our website, it's how we refer to it is what happens in the mouth happens in the body, and almost 6, maybe 7 out of the big 10 chronic diseases, there is some oral bug or oral health involvement or issue, even causal. For example, if you read current studies that connect oral health or bugs in the oral microbiome in the mouth to Alzheimer's, they are now discussing causal relationships. It's pretty clear that it is a way to get Alzheimer's, and of course it's multifactorial always, but it's a very preventable way, and I think that's that's the exciting part of it is oral disease, gum disease, cavities, all of this can be prevented. So yeah, lots to talk about. Definitely an intimate connection between oral health and systemic health, and of course the big question always is, why are they two separate entities when the oral cavity is part of the systemic part or systems in the body?
Well, a lot of different areas we can jump into to start here. Let's go this way and talk about some of the biggest things you see people doing in the oral health realm that are sabotaging health locally and beyond.
Yeah, great question, and it's very prevalent. The thing I first think of, and I shake my head as I do it or roll my eyes, it's the things that we do twice a day. The floss we're using, the toothpaste that we're using, the mouthwash that we're using, all these oral care products are actually causing or increasing the incidence of oral disease. And it's like, well, why is that? And that seems like a very ridiculous statement to make because we've been doing it for so long. But I mean, everything we've thought about oral care products, and since maybe the early 1900s, late 1800s, it has turned out to be wrong. We thought that disinfecting the germs in the mouth, by doing that, we would solve bleeding gums, bad breath, cavities. We also thought that fluoride would reverse the epidemic of cavities. And in fact, it hasn't. It's actually on the rise. And the question is what are we doing wrong? And why are we now seeing this now? And it's one reason, mostly, we now understand the mouth better, more accurately, and in a different way. And that is hopefully having a fundamental, whether you're a provider or a patient, having a fundamental understanding of the oral microbiome. That is what's new. That's new information. It is a way now that we can quantify oral disease by literally getting graphs and numbers. I just listened to a seminar by two hygienists, very well done. And they were talking about the old way. Again, hygienists are on the front line for seeing gum disease. And the old way was to measure the pockets. Most people are used to hearing all those millimeter measurements. It's supposed to be done once a year, even if you're healthy. And a 2 to 3 millimeter pocket is healthy. Anything greater than that, you can get a 12 millimeter pocket, which indicates bone loss and severe rampant gum disease. Bleeding points, bleeding upon provocation, even bleeding when you brush and you spit out, you see a little blood in the sink or blood on your floss. These are all the ways that dentists, professionals, have been gauging oral health or oral disease. Well, now we're looking at the bugs, the bacteria, the prevalence of which bugs are present and how they are interacting with other bugs. We're actually getting numerical, hard data on what is going on in the mouth. And the beauty of that is that we're seeing it before the symptoms appear. So the old way of practicing, looking for the symptomology, looking for these things I just discussed, morphology of the gum tissue, number of cavities. Now we can see it happening before it's the prodromal phase of disease, because we are doing a kind of a high resolution scan of DNA analysis in the mouth and being able to measure the oral microbiome, these bugs in the mouth. We have a much better sense of what's going on in the mouth, and it has changed the course of treatment and how we see oral disease, and also how it translates to infecting other parts of the body.
So for somebody who hasn't really thought of the oral microbiome to this point, whether they're somebody who is living a healthy lifestyle or not, what is the first step? Given the importance of this, how does somebody go about assessing, or is it just about making the changes we're going to get into and then assuming things take care of themselves? What I'm getting at here is, what is step one coming into this, knowing the importance of the microbiome, so then we can begin to build off of that?
So first, that's a great question. First step is, and this is where the change needs to come. First step is, as a patient, and I'm a firm believer in the advocates and the responsibility of a patient or of a person when it comes to healthcare. You have to educate yourself. It's like your financial well-being. You have to take charge of that. You cannot trust a professional. So really, educating yourself, and the beauty now is that you can do this online. The democratization of healthcare, obviously the internet, one of the advantages of the internet, allows us to do that. And then finding a practitioner, and that's the tough part, and we can talk about that later, is finding a practitioner that is up to date and has read all the latest research, understands and appreciates the oral microbiome. So again, back to what I said 5 minutes ago, this comprehension and appreciation for the oral microbiome is key. That is the big factor now in oral health. If you don't know it, if you don't get it, if you don't believe in it, or if your provider, and it could be a combination of all of this, if your provider is not coaching you on this, whether it's your dental hygienist, it can even be your dental assistant, and certainly your dentist, they need to be all on the same team. And the problem with having said that is that most dentists are not up to speed. I would say the majority of dentists are not, especially if they're older, because this was not taught in the curriculum. The notion that this oral microbiome is key to oral health and even systemic health, this is a 8-year-old notion, and it came after all the gut microbiome studies. Gut microbiome data first popped up after the turn of the century, and now, of course, I mean, it's taking off, and the oral microbiome is as important and connected to the gut microbiome. So it is riding that wave, but it's still not mainstream. And so to be mainstream, your dentist would have to be taking continuing education and reading the latest studies. Otherwise, they are literally 15 to 20 years behind the times. So that would be the first step, would be making sure your team, and you're part of the team, and and someone you live with, they have to be part of it too. Because there are factors there as well, the epigenetic lifestyle factors. Everyone has to have this appreciation and awareness of the oral microbiome. And then, of course, that filters down to which oral care products would you choose based on that knowledge. And that's going to change drastically. Your diet, for example, may change. There are a lot of things in our modern diet that, as they do for systemic health, anything for example, with a high glycemic index or load, that obviously is a bad food for us metabolically. Most gum disease is a metabolic disorder. It's no different. There's a cytokine response. There's inflammation. It usually is related to BMI and elevated triglyceride levels, oxidative stress. That's why the gums recede. So it would make sense that diets that affect you systemically are also bad for your oral health. But now we know how it's connected. We know that the oral microbiome requires prebiotic foods. We don't want low acid levels in the mouth too frequently. These are all things now that we can quantify, and we understand the mechanism because we know who the big player is. And these are these bugs. And these are just, I haven't really described what the oral microbiome is for people if this is a new concept. We are humans, but we're actually more than that. We're a superorganism. We are humans. And then we have this other bunch of foreign or actually alien DNA. It's not human DNA in us, and it's bacteria, it's viruses, fungi, yeast cells, and it's not just a little bit. I mean, they actually outnumber us, and they are in us, in our mouth, in our GI gut, in our armpits, probably in our brain. There's probably a brain biome. I mean, vaginally, and all these biomes are helping us. There's this synergy between us as an organism and them. I guess that would be the way to describe it, as an organism. And without a biome, we're done. And what's interesting, I just learned this. We had a death in the family, and I was researching death. And as it turns out, death is not very binary. In other words, when you stop breathing, there's still a little bit of life there. The brain takes a while to slow down. And then the last thing to go is the biomes. The biomes live on for about a month, and they have a role to play, and that is in breaking down the body. Is that connected to the organism of our planet and globally and the environment? I don't know. But so it's all very complicated, very connected, and awareness of this, of the oral microbiome is very, very important.
If you're enjoying the episode, take a second and let me know by clicking like and subscribe below. Thank you so much. And now back to the episode. And it seems to me a good way we could approach this, and you touched on this a little bit when it came to food and feeding that microbiome of the mouth. We could talk about it from things we're going to do to make sure we're repopulating and keeping it healthy. And then with all the different products that we're using, things that we need to be aware of that could be killing that microbiome.
Mm-hmm.
And I think a good way maybe we approach this to start is talk about you specifically, because you've been in this world for so long and you've evolved, I'm sure, your practices and what you do. And I know you have some videos online, but they're getting a little bit older now. Let's talk about what you do in the morning, product-wise, and then we can go about it from that perspective. So we know what good products are, what you're using, what some of the harmful products are. We can talk about as we go through and what might be damaging the microbiome. And then we can move into other facets and impacts that, things like food that are happening throughout the day.
That's a great way to illustrate these concepts, is to just follow and lead. And I try and lead by example. So this may not work for everyone. Of course, the biomes differ from person to person. And for example, if you're mouth breathing, you may want to do a little bit more, and I'll try and touch on that. But given ideal circumstances, you're pretty healthy and you want to remain healthy. And most of this applies to people that already have some oral disease. As you said, you don't want to indiscriminately kill any part of the biome because you really don't know what you're doing, because it's indiscriminate. In other words, a lot of those bad bugs. So, for example, I have yeast cells right now, albicans, Candida albicans in my mouth. I have the E. pylori bug. I've got S. mutan and the P. gingivalis bug. Those are bugs for cavities and gum disease. We all have those bugs in our mouth. We have the bug that causes pneumonia. It's always there. But if in a symbiotic population instead of a dysbiotic population, these bugs are modulated and controlled. They're not put down. They're not disinfected. They're not eliminated. In fact, eliminating them may actually make things worse, but everything is working well. And this is the problem, or this is the easy part. The easy part is just letting your body do what it does best, and giving your body what it needs to do your best. So my regimen is based on that. It's a very complicated thing. Even as a dentist, there are a lot of things that can go wrong. But if you feed your oral microbiome properly, if you don't use the products that are trying to nuke and take out all the bugs in the mouth, then and you disrupt the biofilm and reset it. I'm going to give examples of all of this. That's flossing and brushing. If you can stabilize the pH in your mouth, for example, I'll give you examples of how that may or may not happen. If you can just let the body do what it's been doing for a long time, I mean, the record stands. We're all here still, right? We're able to, our species is still going pretty strong, right? And otherwise we wouldn't be here if something went wrong. But now we're interfering with that process. And even so, the Homo sapien species is still pretty prevalent on this planet. It's questionable how long that's going to last, but we won't get into that. So, okay. So, first of all, I make sure, let me start with going to bed. I try and brush and floss before I go to bed. I do not brush with any minty essential oil toothpaste. Those are all neurostimulants that could kind of engage your brain to the point where it's difficult to fall asleep. Essential oils are all bactericidal. Some are worse than others, so I would not recommend having a toothpaste with anything that's bactericidal in it. Essential oils would be one of those. So I would brush. I always floss before I brush. Flossing breaks apart the biofilm, which otherwise is known as plaque, in between teeth, and then that allows the remineralizing agents, these are minerals in toothpaste, and I'm not referring to fluoride, of course, to get to the areas that need this remineralization. And then I will put my oral appliance in. I do have mild sleep apnea. This prevents my jaw from falling back. But the important part is I tape my mouth closed, which is very easy to do. I do it in the dark. It's sitting right there. I just peel off some, rub it onto my lips, cover my eyes, make sure the room is dark, make sure that the CO2 levels in the room are low, around 500. That means open windows. If I don't open the windows, my wife and I will fill up the room with CO2. Our breathing rate goes up, respiratory rate goes up, and if I measure in the morning, we're at 800 parts per million. That's another topic we can get into. Open window, cool room, get into bed, go to sleep. Taping the mouth closed ensures that the pH of my saliva, which is the backbone of the oral microbiome. In other words, the saliva is maintaining the pH so that these bacteria can function properly. If the pH drops below, I mean, it depends, and we can talk about this too, but there's something called critical pH. Dentin starts dissolving at a pH of 6.2. Enamel starts dissolving, leaching out of the tooth, which is the beginning of a cavity, at 5.5 pH. Doesn't take much to get there. In fact, if you have a dry mouth in the morning, your pH is likely below that, and you've been demineralizing all night long, and your oral microbiome, the bugs, are suffering. They need that neutral pH. They need the fluidity and the saliva flow. They need all the proteins and ingredients and minerals in saliva. So mouth taping, other than for sleep and breathing, that's where most of the attention goes to with mouth taping. It actually helps promote oral health by stabilizing for 6 to 7 hours in your day. That's a huge period of time. Helps keep that oral microbiome healthy and stable. And that way you don't wake up with bad breath or a sticky mouth. take off the tape in the morning. If I have a dry mouth, if I'm dehydrated, then I will drink a full glass of water. Clean water. It can be mineral water. It can be distilled water with minerals and electrolytes added back in. And then, so I will hydrate. If I feel I need some electrolytes, I will put electrolytes into the water. First thing you want to do is hydrate before you do anything else. And then I will brush in the morning with hydroxyapatite-based toothpaste because the teeth need a hit of minerals. Saliva flow drops off in the middle of the night. Your saliva glands have a circadian rhythm, by the way, and they do go to sleep. That's not quite the technical term, but saliva flow drops off. So even though your mouth tape, and that's why you want a mouth tape, because the minute your mouth is open, saliva flow is dropped. After 20 minutes of breathing in and out through your mouth, you're going to have a dry mouth, and that's not good. So I will not floss in the morning unless I feel I need to. I'll brush before breakfast. I don't have breakfast, but if you're going to have breakfast, don't feel bad about that. Brush first thing. That biofilm is thickened up over the time that you've been sleeping. It has altered a little bit because everything's been asleep and saliva flow has been decreased. Even though you've been mouth taping, that helps. You want to break that up. You want to break it up and reset it a little bit. That's what brushing and flossing do. It's a mechanical means of resetting the biofilm, breaking it up, preventing it from getting too sticky, too thick, and allowing it to do its thing. The oral microbiome, all these bacteria live in that biofilm. There's a reason there's biofilm on a tooth. It needs that barrier and layer. It's an immune barrier essentially, and it helps remineralize the teeth. So, and then I go do my protein drink, and I drink more water, and then I usually go to the barn and get some work done and oral exercise, that kind of thing. And then I'll have lunch, and after lunch I won't brush, but I'll chew xylitol gum because it's simple, it's handy. And remember, after you eat foods, especially if they're processed foods or acidic foods, if you brush right afterwards, it can be a cup of coffee. I don't drink coffee, but I drink a lot of green iced tea, unsweetened. Those are acidic drinks, and brushing after an acidic drink or an event where you've eaten something and the bacteria are consuming that food. Let's say you eat saltine crackers at noon. I wouldn't recommend that. But if you do, you don't want to brush for 30, 40, 50 minutes because there's an acid attack going on in your mouth. The biome, and again, these bacteria, when they're like us, when they see junk food, they get excited and they can process it, they can consume more of it, and that via their metabolic process of consuming food, they excrete an acid, and that lowers the pH in the mouth. So you don't want to brush after that. So I choose xylitol gum. That helps stabilize the pH quickly, and then remineralization will reoccur. And then at dinner, I'll do the same thing, or I'll brush after dinner because I do not eat any time after dinner. We try and finish dinner by 5, with the time change now, 5:30, 6 o'clock. We're in bed by 9:30, 10. No meals. Water is fine, mineral water, but no food from dinner. So I can brush after dinner. If it's a paleo meal, I typically brush afterwards. If there's some carbs in there, like even a yam or a potato, I will wait a half hour and chew xylitol gum. And then I brush with an electric toothbrush. I use a Sonicare. And I floss. I use a slate flosser, which is really more than floss. So I use the slate flosser first. I'll use the Sonicare with a hydroxyapatite-based toothpaste. And then I'll read a little bit. We'll watch some TV, sit by the fire, whatever. All the lights are way, way down. If the lights are on, they're red lights or non-blue lights. And then we'll go to bed at 9:30, 10, and then that process starts again. So that's my daily routine other than diet. We can talk a little bit about that. But that's my oral care routine. And I do not use mouthwash. And I wouldn't recommend using any mouthwash out there, even if it's a homeopathic, healthy, quote unquote, integrative mouthwash. A lot of them have essential oils in it. Those are problematic. And mouthwash in itself, save the money, save the time during your normal day regimen of oral care. Focus on brushing and flossing. Mouthwash does nothing. And if you're using an off-the-shelf mouthwash, which 2/3 of Americans do, North Americans do, and 2/3 of those Americans also have high blood pressure. There's a connection there. That's the worst thing you can do. A lot of people will use mouthwash before, after a workout. You're negating the benefits of the workout. You are killing off oral microbiome that produces nitric oxide. So there are a lot of dietary changes and lifestyle changes that you can make. But that's kind of what I consider to be my oral care regimen. No mouthwash, no toothpaste with surfactants and emulsifiers in it, no fluoride, because that causes brain issues and other bone density issues, and flossing and brushing. That's it. And most importantly, tongue scraping. So I will scrape my tongue in the morning and I'll scrape my tongue before bed. Huge addition to the oral microbiome nourishing and feeding it regimen. Definitely scrape your tongue twice a day. Initially, when you scrape your tongue, it's going to take a lot of time. You're going to see a lot of stuff coming off of it. Now I can get away with once every other day because when I scrape, there's nothing there. But if I see something there, I'll keep scraping and I'll go back to twice a day. So tongue scraping, flossing, brushing, and staying away from products that are anything close to nuking the oral microbiome, and mouth taping. That is the ideal. Was that too long of an answer?
No, that was perfect, but I want to take time now and dig into all the nuances because I know for me, I'm curious and I'm sure the listeners are as well. And let's take it all the way back to the beginning. You were talking about brushing and flossing before bed, and you ended up coming around and overlapping after you went through your day, which was great. I think you used the word, it was some kind of electric toothbrush you used at night, was it ultrasonic?
Sonicare, yeah.
Sonicare.
Yeah.
Is that different than in the morning?
No, I always use the Sonicare. I do have a manual toothbrush. I use a Radius toothbrush. I won't travel with my Sonicare. There's a new study that just came out. I have this love-hate relationship with electric gadgets that have batteries in it that we end up throwing into the dump. And these electric toothbrushes don't last a long time. They can be too aggressive. They can cause gum recession. They can be used improperly. Most of us are using a manual toothbrush improperly. If we use an electric toothbrush improperly, it just magnifies the damage that is done. But there was a new study out. Actually, it was from the company that I think actually has the best saliva test or oral microbiome test, and we can talk about that later, but I've referred to it already. Oral microbiome testing is very important for a provider, for a patient. That was an interesting study. They've done a lot of studies, and again, these are wonderful studies because all the other electric toothbrush studies, most of them are funded by Philips or Oral-B Braun. They're done by dental schools. Dental schools, this is a great source of income for them. So if they say too many negative things about these products, they're not going to, this will not be recurring income for them. That's all true, by the way. And it's difficult to get it has been difficult to get a good study on difference between which toothbrush. Is it sonic? Is it oscillatory, rotary? Or is it ultrasonic? They have that category. That doesn't work very well. And then, of course, manual toothbrushes. So there are a lot of variables there. But recently, this study was very interesting. It did demonstrate that the electric toothbrush, if used properly, will increase the number of commensal bacteria in the mouth. And that's a good thing. You want that diversity of population. Too much diversity is actually bad in the oral microbiome, but most of us don't have that diversity, and we need that. And the Sonic Care actually was better than the Oral-B. I used to recommend Oral-B for younger patients because it was great at removing stain and thinning the pellicle, great for kids. After age 40, the Sonicare, because it got in between the gums, because the gums are receding and there's more chance for bacteria to get caught in there via biofilm or plaque. But now I'm a fan of any Sonicare or a knockoff. They're all around 30,000 cycles, but make sure it is actually sonic. There are a lot of brands out there that claim they're sonic and they're not actually sonic. They're subsonic. So it needs to be about, I think it's over 30,000 cycles per minute is the definition of sonic. Make sure the toothbrush head is very soft and well made. A lot of the knockoffs have a good brush, the motor and all that, but the toothbrush head, the bristle softness and the end rounding, softening, polishing of the bristles is questionable. So yeah, I mean, the Sonicare, they invented that category. And there you can buy a Sonicare at $40 and you can go up to $350. I would not recommend the high-end models. You don't need them. It's basically the same toothbrush.
All right, we're really going to get into the weeds with each of these because there's a lot of detail with each step here. As you talk about Sonic and the bristles being soft and you talked about contoured, again, we're going to get into the weeds here. Is there any natural bristles for those brushes? And how do you feel about that versus a synthetic?
Yeah.
I'm assuming on all the electric toothbrushes, as far as I've seen, they've been synthetic. So talk about
it's
that.
Nylon. It's nylon. And that's a really great question. I have not been asked that question. I can tell you exactly how I feel about it. I'm not happy about it. I hate plastic. I try and eliminate plastic in my life. Floss is a big offender in that area, but you can buy a silk floss. It's more difficult to use. If you use floss and it has PFAS in it, those particles are breaking off. Even if it doesn't have PFAS in it, the little microplastics are breaking off. And where are they going? You are ingesting them. It just adds to your PFAS load, which is a whole nother conversation. It's so depressing, and we need to address that. But good toothbrushes are nylon bristles, and then they end up in the dump, and they don't biodegrade. So toothbrush bristles used to be wild boar bristles. They have very coarse hair. That didn't work very well. That can be very abrasive as well. They didn't last very long. Nylon can be very abrasive, especially if it's a cheap toothbrush, which I alluded to earlier. If they just cut the bristles, the toothbrushes it's a nylon, molten nylon in a mold. It gets heated up. Machine comes and has a stack of nylon bristles. It drops it in. It cools quickly. It grabs the nylon bristles, and it goes off to be polished and packaged. Those bristles, if they're just cut, they're obviously cut evenly, or now they have staggered bristles. I'm not sure how they would make that. They probably put in different sets of bristles at different heights. And by the way, those staggered bristles actually work better according to studies. So if they're all cut at the same height, they may not work as well. But my point is that the bristles, each bristle needs a hemispherical end. It's called end rounding or polishing. And because a cut bristle is literally a cylindrical piece of nylon, different diameters. They have nano bristles now. But the edge of that cut bristle is sharp. It's a right angle. And nylon is very abrasive. And that can do irreparable, permanent damage to gum height, gum recession, dentin density, can cause tooth sensitivity to the point where you can't eat certain things. Your teeth will ache. It'll really interfere with your daily routine and your day and focus and concentration. Difficult to fix. So you really have to be careful. And then you put that on a oscillatory toothbrush like the Oral-B Braun, or the Sonic toothbrush that's vibrating, and that just accentuates that wear. So, and then we brush incorrectly. We do this sawing motion. Anyone that brushes in a movie or in a TV series, I've clipped a lot of clips. I think I have one on YouTube of Natalie Portman brushing her teeth. I think it was Black Swan, incredible actress. But I think they're all taught to brush aggressively because it's usually during a very emotional scene. But you don't want to brush that way. You want to jiggle, you want to vibrate. You just, with a manual toothbrush, you just want to circular motions. You don't see that on everyday media on how we brush, and that sawing motion really gouges. And remember, it's the same motion back and forth. So over time, this is something you do twice a day. It will literally leave grooves from tooth to tooth, all in the same direction. And then once those grooves are established, then every time you go back with brushing, the bristles are guided into that groove, and that wear is potentiated, made worse. It accelerates. So to answer your question, we do not have a good alternative to the nylon bristle. And it is a plastic. I wish it wasn't so. I've tried natural versions of it. The best thing you can do is not to have to brush. I mean, our ancestors didn't brush; they chewed on chewing sticks. I think there are people out there that have an excellent diet. They have very healthy saliva. They're not mouth breathing. They could literally get away with chewing xylitol gum and never floss and brush. I have patients like that. But is that the norm? No. I mean, as long as we have the food that we have, even healthy diets, a lot of our foods, I mean, most of our foods are nothing that our ancestors saw. We're too far gone from that. Hybridized wheat, DNA changes, quality of food, even our fruits and vegetables are not what our ancestors were eating. So that is why we now have this Band-Aid. So remember, every time we try and fix something in our society, it's not the full step forward. It's a full step forward and half a step back. We've introduced microplastics and abrasion into our lives because of our chosen diet.
All right. So what I think I'm hearing you say is when it comes to electric toothbrushes, there's no perfect answer for the bristles in the head. What's the best we can do there? And then take that over to manual and talk about what the best we can do there is.
If you're eating well and you're pretty healthy, you're not getting cavities, you don't have a halitosis, your gums don't bleed, I would recommend a manual toothbrush. My favorite is the soft head on the Radius toothbrush. The handle is recycled, made from recycled products. You never have to replace the handle. You're only replacing the head. I mean, so that assuages half of our guilt. Half of the toothbrush ends up in the dumps. And it's safe. I mean, it's a high quality bristle. If used properly, make sure you're checking in with your hygienist. Bring your favorite toothbrush into your dental visit. And there's always time at the end of that 1 hour cleaning visit. The hygienists, the good ones, allow for that. That's the oral hygiene instruction, OHI. We have a term for it. There's 10 minutes where we can discuss, Mr. Smith, you missed this area. Here's a patient mirror. This is how I recommend you get in there. That's the biomechanics of brushing. Everyone's got their blind spots when it comes to brushing. But bring your toothbrush so that they can see you in action. Bring your favorite floss and demonstrate to them what they're doing. Usually you're sitting up and you've got the patient mirror, or they're holding it for you, and they're behind your shoulder, your right shoulder typically, and they're looking at it and they can comment. And if you're overbrushing, they will catch it. And I would say 90% of the time when that happens, I mean, when the patient comes in, 90% of the time we have to take their arm and just say, slow down. If it's an electric toothbrush, bring in a fully charged version of it and get a demo. I think you'll be surprised. They do have toothbrushes in manual and now in electric that if you push too hard, either the motor cuts out or an LED light flashes at you. There is a toothbrush, a manual toothbrush that has a clutch on it. And I remember them sending it to me. I'm not sure if it's in production or not. I can find out. I think everyone should try that toothbrush at least once. When I picked it up and started brushing, the clutch would break each time. So even I was brushing too hard. That the clutch, it's a breakaway thing, it snaps back and it resets. It's very inexpensive. That clutch, they've measured it, breaks at a very certain hardness or force. It's a Newton measurement, and it's very specific and based on studies. I would recommend that everyone try that once. I would say probably 100% of the people that pick that up will be shocked the first time they use it. Like, wow, it only takes that much force to be brushing too hard. And I'm not talking about the motion of brushing. I'm talking about how much pressure you're applying. So that would be important. Did I answer your question?
Yeah, I just want to close off on when somebody goes to the sonic, what's the best they can do with a brush head in that case?
I would say if your dominant hand is your right hand, use your left hand because you're going to be more delicate. Hold it like, I have a pen here. Don't hold it like this. Hold your toothbrush like this. And then my Sonicare as I'm brushing, I'm facing the LED light in the mirror. Actually, when it's dark, which it typically is at night, it just lights up the room. It's a red LED. Thank you, Philips, for making it a red LED. I don't need white LEDs at night. It lights up, and then it tells me that I'm brushing too hard. So it modifies your behavior, and that alone, within weeks, you've got it. For some people, it'll be days, and that's a modified behavior that has ramifications for the rest of your life. Your dental bill will be less sensitivity to your teeth, better hygiene, could be better systemic health in general. So that's what you want to do. You want to be brushing properly with a high quality head, quality toothbrush, and so brushing properly, not pushing too hard, and the right motion. And that's kind of a rolling motion. With an electric toothbrush, you're going to pick it up. It's got a nice broad oval head, and you're going to lay it in the area. And you're just going to move it a little bit and roll it gently, and then you're going to move on. You're going to lift it off the teeth and do that again. You're not going to scrub over back and forth. And by the way, that negates the effect of the sonic bristles, because then you're deadening that frequency by brushing back and forth. So most people are brushing incorrectly with their $200 toothbrushes. I mean, it's very discouraging. And but sonic care is a great way to go. Based on these latest studies from Bristol, I was very impressed with that. And again, it's the first time that a study was done based on the composition of the oral microbiome. Before, all the other studies, those dental school studies I was referring to, it was based on bleeding points and pocket depths. That's so intangible and indirect. And there's so many more factors at play there. Where with the oral microbiome changes within 3-4 days. So that is more quantifiable. It's a more accurate way of looking at differences in the results of using different products.
And I know I haven't had the Sonicare, but I've had different electric toothbrushes over the years. And when you go to replace the heads, there's different choices. And some of them have like Disney characters for kids and things like that. When it comes to the Sonicare, is there a certain one though, like a certain softness we're looking for, a certain bristle? You mentioned the contour.
Good question.
Again, getting really specific for people out there that want to take this to the max.
No, I love it. And it's a great question. And it is, in fact, I just had to replace my heads, and I went to Amazon, and I was completely overwhelmed with the choices. And I wanted to make sure I got the right thing. So I had to do some research and then go to the Philips site and find out that so always get the softest toothbrush head you can get. Look for extra soft. Look for gum brush, or if you have periodontal disease, or a brush for sensitive teeth. These are all brushes that have a softer, maybe it's thinner, a softer bristle so that it gives quicker when you apply force. And then there's and I alluded to this earlier, there's the grouping of the bristles. And that's confusing as well. So if it's just a toothbrush that is cut and the density pattern is even, that's an old style toothbrush, and there are a lot of them still out there. I would go for a rolling kind of. Some tufts are higher than the other. They call that a staggered pattern. It can be oval. Stick with a smaller toothbrush head if you can. Most people don't do well with the big brush heads because they bump into anatomical features back here, and they don't clean around their lower second molars and upper second or third molars, if you still have them, and that can be a problem. And that staggered bristle pattern and grouping patterns, all of those have scientific basis. There are studies that support that. So look for a complex pattern, soft bristles. The way to look at bristles, if you're looking at a toothbrush, let's say you're at your friend's house and you're borrowing a toothbrush and he gives you a cheap, knockoff. If you can see shiny spots on the end of the bristles, that is an unpolished bristle. They should be opaque and very dull. They should not have a shiny finish. So put on your loupes or get your magnifying glass out. You can see this under normal lighting in a bathroom. Compare the shininess of the bristle, the shaft, to the end of the tuft, and there should be a noticeable difference. It should be a matte finish. And that's a great way to tell if you've got staggered, grouping, different grouped bristles. A lot of it gets gimmicky, of course. They've got a big grouping at the end to help poke in this spot and that spot. Try and ignore that, but go extra soft, grouping, staggered bristles, and pick a manufacturer that is reputable and has been around for a long time. And then, of course, really, all of that is important, but your technique is the most important. And try and get a toothbrush that warns you if you're brushing too hard, whether it's manual or electric.
All right, we went really into detail there with the brushes.
Love
Technique, I love it too. Let's move into what goes on the brush, toothpaste. And I know you're a big fan of this, and more recently I've become a fan as well, hydroxyapatite. So as we enter this part of the conversation, let's talk about what that is and then the different types.
So hydroxyapatite is, to make it very simple, is the material, the framework, the reason your teeth are hard and firm and are able to chew food and break down food and begin digestion, allow you to smile. That is the major ingredient in your teeth, hydroxyapatite. It is biomimetic. In other words, it exists in nature. It's in your saliva, or it should be. It's a form of calcium. It's a calcium hydroxyl group. It's got a hydrogen atom in it, some phosphorus. It probably varies a little bit from person to person based on diet, how many electrolytes you have in your system, how well hydrated you are, and the foods you eat, and also pH and dryness of the mouth. But the point is that it's natural, and that's the micro version of it. There's a big controversy between micro and nano. I'm going to get into that. Don't worry. Everybody wants to hear about that. But so that's the micro version. It's natural. They grind it up and they can put it into toothpaste, and that's fine. It does, if it's well made, it dissolves into your saliva, and it's there waiting for when your teeth start demineralizing. Remember, I talked about critical pH, and it's not. I mean, so the pH of the mouth based on saliva in a healthy mouth is 6.8 to 7.2. It's typically just below 7. 6.2 is when dentin starts. It starts the process of dissolution. In other words, it starts dissolving. Dentin is the root structure of your tooth, and enamel starts at 5.5. Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, not to pick on them, but they're pretty low, but there are several others. Coffee, wine, iced tea, my favorite. Those start off at a low pH. And if you're drinking a lot of that, you are forcing that critical pH to drop, and your teeth are dissolving. Calcium is being lost. That's why you want it in saliva, because when the critical pH recovers and goes above the 6.2, the 5.5, then what's the opposite of dissolution? Oh, precipitation occurs. In other words, calcium gets put back into the tooth, hydroxyapatite. That's why it's important to be well hydrated. That's why it's important to have a lot of minerals in your system. Saliva is created by your saliva glands. There's capillary blood flow and capillary beds around your saliva glands. I mean, saliva is very similar to blood, minus the red blood cells and some other ingredients. So it's a very important bodily fluid. Without it, you would be dead. You wouldn't be able to digest your food. Your oral microbiome would be a mess. You would get infections. It's like having a bed sore. You would have rampant gum disease, and you would die from that. Sepsis or slower Alzheimer's, high blood pressure, heart disease, cardiovascular events, that kind of thing. So hydroxyapatite is normal. Now, there is so let me start off by saying micro is ground up calcium, but it's not very bioavailable. In other words, you can dissolve it into saliva, but it's a big chunk of calcium, even though it's dissolved. And when it comes time to be brought to the tooth surface to be remineralized, the chunks, the molecular form of that calcium is so large that it won't fit into all these small demineralized areas, and it won't remineralize those areas. That's where nano comes into play. So nano is under, 100 nanometers. It comes in different sizes and shapes below 100 nanometers. Micro would be above that. And by the way, that's a line drawn in the sand by scientists. In fact, the Europeans are thinking of changing that designation of what is considered to be nano and what is considered to be micro. So again, it's just a line in the sand. But to make micro into nanoparticles, which they're 25x smaller, something like that, you have to synthesize it. You have to manufacture it. So you grind it up even into smaller pieces. But you can make the end result can be needle shaped, it can be rod shaped, it can be more cylindrical shaped. They're different shapes and they're different sizes. And then there's the quality of the calcium. These hydroxyapatite companies are all over. They're in Asia, they're in Europe, they're here in the US. fewer than you would think. I think there's one in Canada. The best one is in Portugal. If we want to get into the weeds, we can talk about that. They make the best nano and the safest version of nano-hydroxyapatite. But nano has it's a 4-letter word, right, in health care. And nano means it's something that is so small that it can get embedded in the body and it's there for life. Well, that's nano titanium. That could be nano silver. Those are metals and other products that don't dissolve. Nano hydroxyapatite, let's just call it calcium. Nano calcium, the minute it hits cellular fluid or a biofilm or saliva, it dissolves and it's in suspension. The good news is that it dissolves into smaller pieces, and when it's presented to that demineralized, that cavity-forming surface of the tooth, whether it's on the root surface or on the enamel, it gets taken up that much more readily, probably even more readily than fluoride. And it's not as electronegative as fluoride, but it has a smaller particle size, so it's more likely to get groups of these little nanoparticles. And by the way, they should be rod-shaped. There are very specific specs on what is the best nano for safety and for efficacy. According to the Europeans, there's no American body that is making these decisions, or Canadian, North American body, which is typical. But so these small particles are way more effective. In fact, I would argue that having micro in your toothpaste is a complete waste of time. And there's calcium. We've had natural toothpaste with calcium carbonate in it. It's a different form of hydroxyapatite. And again, these ions bond to, they're attracted to each other via negative and positive charges, opposite charges. Cationic bonding, and that's what saliva is. It's a cationic solution. It's a supersaturated solution of minerals. And when it sees a positive charge, then these particles are attracted to each other. And pH has a lot to do with that. And that's why when the pH goes above critical pH, that electrical charge, that equilibrium of dissolution to precipitation changes and it doesn't occur. So if you're below that critical pH, you're losing calcium in the tooth. If you're above it, you're laying down calcium. The teeth are taking up that calcium and rebuilding themselves. This is a natural thing. The body has always been doing this. Our ancestors had this mechanism. They were eating raw fruits and, raw vegetables, maybe fruit on occasion, some dates. That would happen occasionally. They would eat raw meats, and then they would cook their meats, and a lot of dairy products, fermented dairy products, and even compared to our current meats selection and fermented products, much, much different. Even the vegetables were different. They really were, that mechanism worked fine. They never got cavities. There may have been some critical pH moments, acid attacks in the mouth, and then it was quickly reversed and healed. And also, they didn't eat as often as we did. We snack constantly. And that is so hard on this remineralization, demineralization equilibrium, because it's always trying to fix the teeth. It never has the time to rest. That's why taping up your mouth at night is so important. That's a 7-hour rest where the body has a chance to remineralize your teeth. Clean them, brush them, floss them, thin that, reset the biofilm, tape up your mouth to keep the saliva in there, add the hydroxyapatite. Oh, by the way, important for oral care regimen, don't spit out. You can spit out, but don't rinse after using a hydroxyapatite toothpaste. So I just coat my teeth. I use a nano manual toothbrush. It's like a squeegee. I get that toothpaste on there, and then I put my oral appliance on. I'll spit out, but I put the oral appliance on there, so my teeth are coated in hydroxyapatite all night long. That 7-hour window is wonderful for repairing your teeth. If you're snacking all day long, that window doesn't exist. You're always on this side, on the demineralization side of the equilibrium. If you're sipping on a Diet Coke even, a sugarless beverage, or even an iced tea, any snack, any cracker, for example, a saltine cracker, or even a healthy rice puff or something, without industrial seed oils. And it doesn't matter. The bacteria are very active in the mouth and they are demineralizing your teeth. So that's another reason intermittent fasting works well in the mouth. So if you're going to snack on a raw carrot, don't worry about it. If you're going to chew on some xylitol gum, don't worry about it. But typically our snacks, even any healthy sports bar, probably is causing an acid attack in your mouth. And we snack on that at work. We drink coffee at work.
I want to highlight what you're getting at here. The fact that it's not necessarily the amount total, it's the number of touch points.
It's
And because
frequency.
of the modern way we snack and we drink, we have touch points all through the day affecting that acidity, causing the issue.
Exactly. So the frequency is more important than quantity. So if you're going to have that birthday cake, wolf it down quickly and don't do it again for a few days. Let the teeth recover.
So I want to get into some more nuance before we leave the hydroxyapatite piece. You stated there the fact that the micro might actually be useless.
Mm-hmm.
The nanos we're looking for. I want to make sure we tease out the scare for people. You talked about the fact that when it comes to different, nanoparticles, they can get lodged in the body. Is that the same thing when it comes to hydroxyapatite? What is the fear people have over that?
Right. It's a great question, and there is a lot of it. I'm very surprised. I'm the first one to cave in. I'm so paranoid about everything we put in our mouths, in our bodies. It's almost an affliction. Discussing and filtering everything that goes in your body. But the nano, first of all, it's been considered this specific version, this rod-shaped nano version. And it's in a globular, fluid. It's made by a company called Fluidinova. It's called Nanoxim. That's their brand name for it. And it is currently the only version of nano-hydroxyapatite. It's got hydrogen groups and water. It's a little globular liquid version of nano-hydroxyapatite. And it dissolves very quickly. It stays in suspension, and it's readily available when the tooth needs it. And if it does get out somewhere, calcium dissolves. I mean, without calcium, we would be dead. So there are some studies. There's a zebrafish study. A zebrafish is not the same as a human being. We have totally different protective mechanisms and even cell walls and all of that. So you can overcome a zebrafish very easily with so many different things. Even a hypertonic solution will kill, or a hypertonic solution of salt will kill a zebrafish. So there are a few studies out there. They're old. This is a product that was designed by NASA 40, 50 years ago. It's been in use by the Japanese and less recently by the Europeans for 50 years. Something would have come up. There's some oral surgeons out there that say this is causing calcification of the pineal gland. Calcification of the pineal gland occurs with calcium, period. Any calcium, a calcium supplement. It can occur with fluoride. And it's really about your calcium metabolism. You should really worry about what any calcium that you take in can be from leafy green vegetables. It can be from a supplement. By the way, I don't recommend calcium supplementation, but I do recommend that you worry about your K2 levels, the amount of this vitamin that literally is the shepherd. That's a great word. I forget who used that term. I loved it when I heard it. It takes the calcium to the right areas. It takes it out of the bloodstream and puts it into calcified tissues. And that's where you want your calcium. And it also takes calcium out of tissues that shouldn't be calcified. Or if it needs calcium, it'll pull it out. It'll also pull it out of bone marrow and the reservoirs of calcium. Calcium metabolism is second in importance to glucose metabolism. If we don't get it right, we're dead in the water. So I'm not worried about calcium at any size as long as it's dissolved, because calcium, every cell has calcium in it. It needs it on both sides of the cell wall. So again, it's approved. It's been tested. There's a group in the EU called the SCCS. It's a Scientific Council, Advisory Council. These are very well-known scientists. They have a 3-year stint, and then they're replaced. I don't think they're paid to do this, and their votes are silent so that they're not, punished by the industry in case they know how they voted. And they approved this version, and they were very clear that they're going to approve other versions. And they're also that same committee that are trying to redefine what is a nanoparticle. But if it's nanosilver, nanotitanium dioxide that's in sunscreen, once that gets out in the body, it's toxic. The body has to wall it off. I agree with that. There are nanoparticles that should not be used and we should not be exposed to. Microplastics are small enough to cause a lot of harm. Are they breaking down into nano-sized particles? I don't know. So it's safe. It works well. Back to what you said at the beginning of this topic, micro, you were wondering, you were commenting on the fact that I said micro is pretty useless. It is. It just doesn't work as well as nano if you compare the two. So I would want nano in my toothpaste because it works so well. I know it's safe, and you just have to use the right version of it, and then you'll see the results. If you have sensitive teeth, nano-based toothpaste, hydroxyapatite toothpaste, will work within 2 to 3 days. It'll be the best solution. These people have been looking for a solution for a long time. Sensodyne, pyrophosphates, resin covers, coverings, fillings at the dentist. Most of that stuff doesn't work. In 3 days, a nano-hydroxyapatite toothpaste will work because that's how quickly it remineralizes. A micro won't do it, ever. Now, there are some toothpaste, and I think this is very smart. They have micro and nano in their formulation. It's good to have micro in saliva because it helps with the ionic stability and integrity of saliva. Saliva needs this ionic structure of minerals. There are other things in saliva that are also important, and the micro particles help maintain that. But when it comes to remineralizing teeth, they're left behind. It's the nano that does all the heavy lifting. So I'm okay with nano. I've done so much research. I am probably the most paranoid person out there when it comes to healthcare. Probably not, but I'm up there. And I've researched this. My grandkids use it. It works. And I would rather have them use this and not get cavities, which then later lead to bigger fillings and then crowns and then root canals. So anyway, it's safe. It works. Just make sure you use the right version and make sure it's in a toothpaste formula that doesn't have other issues like surfactants and emulsifiers and things like that. And then, of course, you have to thin and modulate and break down and reset the biome so that it can absorb these minerals.
Okay, so when it comes to the nano, benefits are going to be sensitivity, remineralization. I know whitening is a piece of that as well.
That's true. We haven't talked about that.
Yeah, talk about that and then any other benefits I missed.
You are well informed, Jesse. So whenever a patient wants to whiten their teeth, first of all, I never bring it up. I don't think that's something a dentist should bring up because that's a very personal decision. And if they do bring it up, I'll say, let's try, are you using a nano-hydroxyapatite-based toothpaste? If they're not, I would say use that for 6 weeks and let me know. Come back and let me know. It's inexpensive. It works. It's safe. And it's better than the whitening process that dentists use. And then there's the over-the-counter version, which is even worse and more dangerous. Let's try that first. And as it turns out, when nano gets incorporated back into the tooth structure, the enamel line, the crystalline structure of enamel, it's an apatite structure. That's a crystalline circular structure. It's a mirror finish. A fluoride actually is very electronegative. It gets pulled into remineralization cycles as well, but it's a wavy, brittle surface, and so it becomes a very dull finish. Nano-hydroxyapatite, on the other hand, is a very smooth, reflective. It has high reflectivity. So it's not necessarily the color that changes, but the teeth become a lot shinier. And a lot of people, I would say at least 20%, are satisfied with that result because it's really biomimetic. It's the way our teeth were meant to look. It's biomimetic is a material that is found in the body, and that's what's being added to a nano-hydroxyapatite toothpaste, and that works well. If you do want to whiten your teeth, then you have to use a tray-based system with a strong oxidizer, hydrogen peroxide-based, and that has issues. It can damage tooth structure, pulpal tissue if overused, and also, this doesn't get discussed that often, it's hard on the oral microbiome.
Okay.
So I would try, hydroxyapatite does have a whitening effect. And people are surprised by that. And the question is how white do you want your teeth? If you want them paper white, I don't think hydroxyapatite will work, but that's because that's not what nature intended. So then but try that toothpaste for 6 weeks first. that may do the trick. There is a whitening effect, and it's based on reflectivity and the surface structure, less brittle, smoother finish, as opposed to fluoride. Fluoride could actually be making your teeth look dull, believe it or not. And also systemic health. If you're not a healthy person, your pulp chambers will be affected, the health of the tissue inside the teeth, and your teeth will yellow from the inside out.
So what I'm hearing you say here is the teeth are porous, and whether it be fluoride or the nano-hydroxyapatite, they're going to take in these materials, and with the fluoride, it becomes more dull, and it's going to be more reflective with the nano-hydroxyapatite. As I'm picturing them take these up, and why I'm going here is because a lot of people have used fluoride over the years. You know, I remember back when I was in school, we'd do fluoride treatments. I think it was weekly. How long does that stay in the teeth, whether it be the nano-hydroxyapatite or fluoride? And again, the reason I'm interested is how can we get that fluoride out to put the better nano-hydroxyapatite in?
Right. That's a great question. I don't get asked that often. It's very likely that the hydroxyapatite will be replaced. It will get demineralized, and then remineralization will occur. Fluoride sticks a little bit better to teeth. That's one pro that the fluoride activists really lean on. And that's fine. And it's true. Topical fluoride does work. And it dissolutes or comes out of the tooth at a lower critical pH. So if you stay above that lower critical pH, which you're more likely to do, then you're less likely to lose that patch. But it came at a great cost, and that was your IQ, and other things. It's a neurotoxin, and arguably the fluoride that's in the tooth is the least of your concerns. It's inert, it's there, it's not floating around in your bloodstream, it's not getting past the blood-brain barrier and causing inflammation in the brain. So, but it can dissolve out, but the nano-hydroxyapatite itself is more likely, again, because it's like the rest of the tooth surface. Where the cavity occurs is based on where the food is collecting, where the biofilm is thickest, and where it's dysbiotic. Or it could be in an area that you're missing with a toothbrush or with floss. And so if it's the same spot every time, that over time will lead to a cavity because the tooth can't remineralize itself because it's always being fed this cariogenic cavity-causing food. And it may be a dry mouth. By the way, kids have a higher critical pH, which is mind-blowing to me. I never knew that. And this is an old study. It's they don't tell you that in dental school. So in other words, kids are more prone to getting cavities because the demineralization part of the equation starts earlier. Starts at a higher pH, closer to neutral pH, and that's why kids get a lot of cavities. That's not the only reason, but if you're a pedodontist, I can send you that study. That is really mind-blowing. So, but you can. I think what you're trying to ask is, can you get fluoride out of your teeth? It's possible. I wouldn't worry about it. If it's there, leave it there. If it comes out, you'll digest it, and that'll be that. And you'll replace it with nano. So stop using fluoridated products. Filter fluoride out of your drinking water. Don't use fluoridated toothpaste or mouthwash. And you won't. I mean, you've cut it right there. I mean, there's no way to chelate fluoride out of your teeth. Just by using nano-hydroxyapatite over time, your teeth will be very strong, and you won't have to worry about the fluoride that's already in your teeth. Remember, when you're ingesting fluoride as a kid and your teeth are forming in the gum line, in the jawbone, the enamel organ, which is the pulp tissue of the tooth, it's getting fluoride's in your bloodstream, and it's systemic, and it's being taken up by the enamel organ. And so you've got fluoride. Most of us that were drinking fluoridated water, like I did, unfortunately, I grew up in San Francisco, and I checked, they had fluoridated water when I was around, and it was high. It was 1.3 parts per million. They've dropped it now down to 0.7. They've halved it. The fluoride was running around in my brain and my body, and the enamel organ was picking up the fluoride when it saw it in the bloodstream, got into the pulp tissue, and it was part of the lattice work and the matrix that it was laying down to form the tooth. So if you're trying to get rid of fluoride and you've grew up on fluoride, you've got it deep inside your teeth, but it's inert. You don't have to worry about it. Once it's there, it's there. It's like deeply embedded in that concrete bed. You're never going to see it again.
As we talk about different things that are applied to the teeth that are at least staying there for a period of time, it gets me thinking about glycerin in toothpaste. And I don't know if this is fact or fiction, but I've heard that when toothpaste has that in it, it's actually clogging up the teeth and not allowing the fact that they're porous to do what they need to do.
Right.
So is that something we need to be aware of and avoid, or what do you think?
Yeah, it's important to talk about all this, and it's a I don't want to call it a rumor. It is something you see on the web. It has one source. I forget his name. It was a professor from Purdue in Indiana, great university. Not sure what his background was. It wasn't in microbiome or in dentistry. It was some other area, chemistry or something. He had a PhD. And he kind of on the side said some interesting things about oral health. Some of it was correct. It was before knowledge of the oral microbiome. He had good instincts, but then he talked about glycerin interfering and acting as a shield and preventing again, he was all about removing plaque 100%, which is not what you want to do. You want biofilm. Biofilm is a good thing. Back then they were calling it plaque. And then it would get incorporated into the biofilm layer, I'm using the more current term, and would interfere with remineralization. He didn't quite say that, but it was bad for the teeth. It was a coating. And in fact, that's not true. We know this. I mean, glycerin is 100% immediately water soluble. It's used as a thickening agent in toothpaste. It was glycerol from vegetable oils in the early days. Now, of course, it's all synthetic. In some ways, that's better because they didn't use chemicals trying to distill it down from vegetables. But it's pretty harmless. If you can avoid it, I would say absolutely. Avoid it if you can, but I'm not too concerned about it. I've done a podcast episode on that. This gentleman retired to Arizona. He has like a little manual, and in that manual, it's 10 pages, handwritten, I think, or old typewriter face. You can find it on the web. I have scoured the planet for data on glycerin, glycerol in all areas, whether it's shampoo or anything like that. And the stuff he says about glycerin is not true. And again, he has no scientific data on it, and he has no studies on it. So I don't want to diss him. He said some very interesting things, but this was a professor that had a different background that on the side probably had some dental issues, and he was kind of a interesting guy that had some ideas, and he came up with some interesting concepts, but this is not scientifically based, and you don't have to worry about glycerin.
Important we talk about it. I know for years I was avoiding it, and I think that's what drew me to earth paste. And I think that's one of the toothpastes you have on your website.
Yes.
I've since switched to a hydroxyapatite toothpaste. I don't think the earth paste has that in it. You can correct me if I'm wrong.
It doesn't. In fact, they added colloidal silver, which worries me. I love the consistency, the packaging, the concept of bentonite clay with minerals in it. Bentonite clay has a lot of good things about it. You can use bentonite clay that has lead in it, which is ambient, natural levels of it. You can also find a pharmaceutical grade of bentonite clay that has lead at such a low level that you don't have to put the lead warning on there. But adding colloidal silver to something that you put in the mouth that gets absorbed through the oral mucosa that can get into the blood supply. I mean, silver, it's probably not high enough concentration to worry about, but the benefit isn't. And if you're going to leave out hydroxyapatite and there's no remineralizing agent in, that just doesn't make sense. So that's my reset toothpaste. It's kind of like, if you don't want, there are a lot of people out there suffering. The majority of us are suffering from typical toothpaste because of the emulsifier and the surfactant. These are soaps and detergents, anionic agents is the industry term for it, that are there just to make big batches of toothpaste so that it's profitable, even more profitable. Because when they mix it in big batches, it's very hard to mix toothpaste and get all the ingredients to mixed to begin with and stay mixed when you put them in the tubes, and then for them to have that even consistency. It's like the McDonald's of of toothpaste. You want each tube to be exactly the same. So you put in all these chemicals, and that actually irritates and dries out the oral mucosa. The oral mucosa is like the lining of the gut. It's porous. It does let things get through to the blood supply systemically, like fluoride and infections, and people get a lot of mucosal irritations, canker sores, and ulcerations, and it's very painful. And so that's a great way. Whenever a patient has geographic tongue or any kind of erosive kind of condition in the mouth, I always tell them to stop using all oral care products, because that's usually where it's coming from, or at least it's irritating it and preventing the body from healing itself. But but the colloidal silver, I was disappointed that they added that. It worries me a little bit. They add it because it has an antibacterial effect. Bacteriostatic is the term, and it's simple, it's cheap, and Redmond. That's the basis of all their products. Love most of their products because they're near a mine, near the Great Salt Lake, and I've been to their headquarters. I think it was in Utah somewhere. Was it St. George? I think, and incredible company, great concept, but it's all based on what's coming out of the ground, and that isn't adding stuff to that isn't the right thing. What they should be doing is adding nano-hydroxyapatite to their formula.
And from preparing for this interview and chatting with you today, one thing that becomes really apparent is you mentioned the fact the colloidal silver is going to kill bacteria. This ties back to the essential oils earlier when you're talking about those. The fact that isn't the goal anymore. That seems to me, again, from talking to you and listening to your work and preparing, that's an old school kind of mentality where we're trying to kill and overpower the microbiome in the mouth. And now your approach is more gentle and working with what we have and creating an environment there where things can flourish naturally.
I mean, there's no gentle version. I worry about the word gentle because it's still a way of trying to disinfect the mouth. It's a complete 180-degree turn of no attempt at disinfecting the mouth. It's nourishing, feeding, providing, optimizing. And that's why toothpaste should really be like food. There should be a prebiotic in it. There should be minerals in it. These are all the things that it should be reversed saliva. You should take saliva and reverse engineer it and put it into a tube. That's ideally what toothpaste should be. But that's not what toothpaste is. It has all sorts of chemicals and other things. And you look at toothpaste and, when I look at food ingredients, if I see 3 or 4 words, I don't even need to read it. I know it's good food. But then you see the fine print and the big paragraph, that that's a very manufactured food. It's the same thing with toothpaste. A lot of toothpaste manufacturers have to add all these botanicals, and there's no evidence that those things work. In fact, neem oil, which is an old Ayurvedic, there are other things too. Cinnamon oil. There's a very well-known influencer in New York that used a homeopathic toothpaste, and it just had cinnamon oil in it, and he couldn't talk for 2 weeks after using it. He reached out to me, and I felt so bad. It was the essential oils, and they are bactericidal. And so all these botanicals and cute, wonderful things, it's not a face cream. And even that doesn't work on cosmetics. There's no science behind it. So, and there is a skin microbiome. I would be very wary of what you put on your skin. But the skin inside the mouth is even more fragile. It's 1 cell thick. This epidermis is permeable, but it's got multiple layers, and it's more, of course, because it's on the outside. So be very careful what you have in your toothpaste. Toothpaste should have very few ingredients. It should have a lot of water and aqua. It should have no surfactants and emulsifiers in it. How do you do that? Probably bentonite clay, which is wonderful. It's adsorbent. It has a great taste and feel and structure to it. Hydroxyapatite, certainly. Stay away from fluoride. But yeah, there's a lot to know about oral care products, and probably the best oral care product, if you're healthy, is none at all. And maybe maybe just a chewing stick or a little xylitol gum. And I have patients that do that, and they've been doing it for decades, and they're fine. But you should see their diet.
Well, I think we're saying the same thing. Less is more. And it's very fragile there. And we don't want to go in there pretending we know better and we're trying to overpower with things like essential oils and different things that are killing bacteria.
Right. Even a gentle version of that is still suspect, and we should be very aware of it. Again, we need to do that 180 and look at it completely differently.
And the other thing about earth paste that I always worried about was the fact that it was so coarse, or at least it seemed that way. And especially I've gone back and forth, manual, toothbrush, electric. When I'm using electric, I always felt like, is this doing more harm than good with that clay on there and just blasting away at the enamel?
Yeah,
How do you feel about that?
It is thick. I'm not so worried about it. What I do worry about is RDA, relative dentinal abrasivity. That's a measurement of how abrasive the toothpaste is overall. So it could be the clay, it could be silica, it could be aluminum, alumina silica. There are all sorts of things that they put in toothpaste to up the abrasion, and especially if it's a whitening toothpaste, that's how they're getting you to think that this is working. They're using a very abrasive toothpaste to remove a lot of the stain. And so when you look in the mirror, that's what it's all about. They're selling you something that you want. So obviously when you look in the mirror and you go, "Oh my God, that works," you're going to buy it again. But they're not selling you something that you need. That's something that is safe. And that's the problem. That's that 180 that we need to do. So just look at RDA. If you like a toothpaste and it's not published anywhere, and if you go online and look for relative dentinal abrasivity index, you'll see a lot of sources. You'd be surprised how high it gets. Anything under 50 is fine. I like under 35, and by the way, there is a bentonite clay-based toothpaste that's coming out end of this month, and it doesn't have that clay-like feeling. It's a great binder. It's a great way of holding all the ingredients together. But sometimes the clays dry out a little bit, or they get a little chunky, and you feel like I wouldn't go by that. I mean, you could take a piece of acrylic, just go down to Tap Plastics, get some cheap acrylic, take your toothpaste with a brush, and mark an area with a little marker, and take some toothpaste, take a whitening toothpaste, and brush for about 10 minutes of that piece of plastic, and then take a very safe toothpaste, and you'll see the difference. You'll see gouges and scratches in the plastic. So but RDA, if you like a toothpaste, reach out to them. If they tell you it's a company secret, proprietary information, move along. That's bullshit. It should be readily available in their FAQ. Go with 50 or lower, and you'll be fine.
You quickly mentioned their whitening and stains, and we did touch on whitening when it comes to the hydroxyapatite, the nano. It got me thinking about oil pulling. How do you feel about that in the sense of using, say, a coconut oil, swishing it around your mouth for whitening purposes and beyond?
Oil pulling there's nothing wrong with it. I'm a big fan of Ayurvedic medicine. I call that multi-generational observational healthcare. And in a way, I did that in my career. I've been working for almost 40 years, and there are a lot of things that I discovered on my own by observing, even multi-generational. And in other words, kids that grew up and then had kids, and so you don't need to have scientific data necessarily. Oil pulling has some good data. I think it's overdone a little bit. I think a lot of the questions I get are, can I just oil pull and not see my dentist? And I have bleeding gums, I have gum disease, I'm just going to oil pull and that'll take care of it. No, oil pulling does not reverse gum disease. It doesn't heal in a dysbiotic mouth. If your oral microbiome is off, there are other things you need to do. But it's great at preventing a dysbiosis by thinning the biofilm because of the one ingredient in coconut oil, lauric acid. It's great at naturally thinning the biofilm. I wouldn't swish for 15 minutes. That can overdo it a little bit, but that's when you really feel the difference. And again, everybody wants to recommend something so that you go back to it and buy their product because they want you to feel the glean, the clean. That's overdoing it. I would say oil pulling 2 to 3 minutes a day. I think when you asked me early on in this interview about what my protocol was, I did mention if I had a very dry mouth, I will oil pull for a few minutes in the morning. It's a great way to reset and moisturize the mouth. So I'm all for it. In terms of whitening, not a big benefit there. Not a big benefit there. I mean, nor should there be. There's just no mechanism there for it to occur. Does it remove staining? Probably not.
Got it. When it comes to hydroxyapatite and the remineralization, how far have you seen that take people? Like somebody with a small cavity using that toothpaste over a period of time, is it more just to prevent cavities or can we actually have reversal?
That's a really good question. And a lot of people get cavities, full-on cavities. They get the diagnosis from the dentist. I'll even look at the x-rays sometimes. And then they think just by eating better and using a toothpaste that I would recommend, that'll all go away. And that is unfortunately not possible. When the decay reaches that dentinal enamel junction, that's where the enamel ends and the dentin starts. There's no remineralizing that ever. You have to cut it out, remove it, and fill it. So the trick is to know to what degree, how deep is that cavity. Typically on an X-ray, you can pick that up, although an X-ray is misleading. An X-ray will only show about 25 to 40% of the actual amount of decalcification. So when you see the lesion, let's say it's an incipient lesion, very small cavity, you may have to double or triple the penetration. And if that does reach the enamel, the dentin, then it's a call you have to make as a provider. But you can remineralize small lesions that are engageable with those little picks that we use on the grooves of the teeth or in between the teeth that are visible in x-rays with a nano-based hydroxyapatite. Soon there will be on the market the varnish that we get up until age 14. Every kid gets their teeth clean and then they get that thing painted on their teeth. It has an insane concentration of fluoride on it that, of course, goes right to the brain. That will be replaced now with a new hydroxyapatite-based varnish with L-arginine and prebiotics in it. It tastes better. No more fluoride face. We call it fluoride face. When they taste that, they're just like, or they vomit on you. That's very common in dentistry. That's how bad it tastes. It also has hexane in it and propylene glycol and all these crazy ingredients. But a very prescription strength version, 8 to 10% of nano-hydroxyapatite, most toothpastes are 1 to 2%, painted on your teeth after a cleaning can also help. And also ozone. If the dentist is on top of their game, they can apply ozone oil. So there are a lot of protocols and regimens that are in place that will help remineralize teeth. The question is, how deep is the lesion and who's your provider?
What specific brands can we recommend? Given that most people aren't going to take what we just said and analyze every toothpaste to that level, what would you recommend to people?
It's a great question, and it's always changing. And our recommendations always change. But first of all, no offense to the big corporations, but what they're making is absolute crap, and it's actually causing harm. For example, elevating your blood pressure. I mean, the fact that this is still going on never ceases to amaze me. So I will never recommend any of the major brands because they're all making toothpaste essentially the same, based on a model from the early 1900s, late 1800s. It's kind of like you read about Sudafed, all these decongestants that have been pulled from the shelves of pharmacies. This is over-the-counter decongestants. That was all approved in 1938. And again, it was just observational, and it's been pulled because it never worked. In fact, it was just a placebo effect for the people that swore by it. And there's no point in taking a lot of Sudafed because it has side effects for something that doesn't work. Fluoride is the same in toothpaste. A lot of these products and soaps and detergents, the thinking is based on old science, pre-science actually. So I can't recommend any of those brands. I mean, I try because they're readily available. There are, just as there are food deserts, there are toothpaste deserts. In the US, you can get most anything mailed to you. A lot of people in Canada, I get a lot of emails and Instagram DMs about I can't get what you're recommending in Canada, and I feel bad. And then the other thing I feel bad about is that these toothpaste cost twice as much, the ones I recommend, than the big corporations. And I'm not recommending it because they are more expensive. I'm not involved with these brands. Maybe I have an affiliate with them at best. But that's what's required to make a healthy toothpaste. And so these boutique brands that I do recommend, I'm going to name a few, it costs more to make. But thank goodness they're making, at least they offer a choice. I always tell people, if they're price sensitive, just use half as much. It's going to be the same. It'll have a much better effect just by using half as much of the good stuff as any amount of the bad stuff. So my go-tos for a long time have been Boca and Risewell. I knew the founder of Boca. He's moved on. He sold the company to another company, and it looks like they're keeping on with the same formula. And I don't like their new whitening toothpaste, but that's just another discussion. Risewell's been doing a great job. That is actually a dentist that came out with that formula, and it's nice to have a dentist behind it. And that's a good formula. They've just recently gone to nano. They held off on nano. Boca was the one that brought nano to the market and allowed America to try nano-hydroxyapatite. So I have to give James, the founder of that company, a lot of credit. And he just looked at the data. His parents owned a dental supply company, so he was kind of in the industry, but no dental background other than that. And he looked at all the data that was available at the time. This was about 8 years ago. And then he saw that NASA had developed nano-hydroxyapatite for 0G life and bone density issues and all that. And then he saw that, and this is all on the web, you can look this up, that a Japanese company 50 years ago bought the license to use it and put it in their toothpaste. And they've been using it ever since with great success. The Europeans have been using it recently, and now America has it via these boutique brands. Do you see it in Crest and Colgate and Sensodyne and all the big brands? No. Will you ever see it? You will. They probably will buy these small boutique brands, but only when there's a big enough market for it. So trust me, they are watching everything I'm saying and other dentists and influencers are saying, and they're looking at the market. I've had conversations with PhDs at Colgate, very frustrating circular argument discussions, and they're sticking with their formula because it makes them a lot of money. I mean, a lot of money. It's easy money. It costs Colgate 30, 40 cents to put a box on the shelves at Target. And what does it sell for? $5, $6? But then all the damage it does, it's almost like the food industry. They don't care. They provide something that makes you sick. Boca, again, great brand. Risewell, great, but they do use emulsifiers and surfactants. Some feedback on Boca, people complain about irritation. I've had that from day one. Risewell taste, not my favorite, but it's a great brand, and they just added nano. Great for kids. Kids love Risewell. So your kid from day one should be using Risewell toothpaste, for example. I mean, not Crest or Colgate. And then good news is that everything I've been saying about toothpaste, I've incorporated along with my business partner, Dr. Stacy. She's a pediatric IMF certified dentist in Portland. And then my daughter, the three of us, have put together a toothpaste called FYGG, FYGG, Feed Your Good Guys. And it is an oral microbiome friendly toothpaste without emulsifiers and surfactants, with a prebiotic and nano and micro in it. So everything you've been hearing me talk about is in this toothpaste. So I'm very excited. There are choices coming. And are any of these boutique brands going to take down Colgate and Crest? No. we are providing we're giving the consumer a choice, an educated consumer a choice for a better destiny in oral health and even systemic health. And these mouthwash companies that are pushing Listerine, and I mean, it's really, I'm surprised they're not being sued. In fact, I think there will be lawsuits. There will be lawsuits. I hear this all the time of practitioners, dental practitioners, mentioning this to their patient, taking them off of mouthwash, and 6 to 12 days later, seeing a drop in blood pressure, and sometimes getting off the high blood pressure medication. These are in borderline cases, but this is a crime. This should not be happening. This should be brought to the forefront. These studies that are in place are already 15, 20 years old. We keep seeing them pop up. We understand now nitric oxide, the NO synthase pathway, and how the oral microbiome is a big part of that. And how, as you get older, that's really the only way you can produce this endogenous prebiotic and vasodilator in the body. And we're knocking it down by swishing with this crappy product that has other problems as well twice a day in it, and it has no benefit. In fact, it's slowly killing you. So my recommendations are always, I mean, these are usually small brands because they understand. Now, not all small brands are safe. A lot of them load it up. They don't have nano-hydroxyapatite. They stay away from that. They listen to all the hype. There's no scientific discussion or examination of the studies. They put in EOs. They put in other things, botanicals, and they think they've got a great product. They're really just making a fancy, fluffy face cream for inside the mouth.
Well, congrats to you guys on the new toothpaste. Did you say a month that'll be available to the public?
End of the month.
End of the month.
We're going live I mean, probably by the time you air this, it'll be available. It'll be FYGG.com, FYGG.com. I'm very excited. I know my followers will be. They've been chomping at the bit to get something that Dr. Burhenne or Dr. Stacy, I mean, we both are on the same page on this, something that we can unequivocally say, oh God, this is what I'm using at home. So yeah, I'm excited.
That's awesome. And will that be available in US, Canada? How far will you guys ship?
Yes. So we are working hard on getting availability in Canada. Canada has some strict tariff rules, and shipping is expensive up there. What we've been told, we ship out of Salt Lake City, out of Utah. We are going to enter the EU market. We're going to enter certainly Mexico and Canada officially at some point, because we do. I mean, again, we're in touch with a huge audience that knows about toothpaste and knows what they want. A lot of these boutique brands don't have that feedback and that connection. And so we are trying our best, because we get a lot of people going, these are moms with kids. They needed Boca, they needed Risewell, and it was hard for them to get, or it was very expensive to get up there. So as far as I know, and don't hold me to this, but anyone can reach out to me on Instagram as these things change. I'm happy to get back to you. Our fulfillment center will ship to Canada. I just don't know what shipping will be. We do have the USPS option for shipping, United States Postal Service, which is the cheapest, like third class mail. Maybe it takes 4 weeks, but it could be very inexpensive. And we're not going to charge you anymore because you're in Canada. So I hope it is available right off the bat. But if you see the website and you're excited and you want to buy some, reach out to me. We'll see what we can do. We're working on that. I spent a lot of time in Canada. I've got friends in Canada. I went to UBC in Vancouver, University of British Columbia. It's you definitely need this stuff.
Okay. Well, for people out there who say it's before they have access to what you created here, what toothpaste are you using? Because it sounds like until this, what you're clearly saying here is the fact that there isn't a perfect toothpaste on the market.
Yes.
We've come a long way.
Right.
You said 8 years since the hydroxyapatite, but there just isn't a perfect one out there. So what are you using until this?
That's a great question. Well, the immediate answer, of course, is I'm using my own toothpaste.
Until this, yeah.
Right. And that's been now for the last 2 years, because I've been testing it. And, testing means in my mouth, in my family's mouth, in other people's mouths, checking to see what it does when it sprinkles on the sink, and does it stain clothing? Does it make a mess on the mirror? What's the consistency like after 3 months? All of those things. But again, Boca and Risewell. Those are the recommendations that I had made. Very proud that we stood behind them and helped them start. I still, if you can't get our toothpaste, I would still recommend them because they are way better than what's available on the the big corporate choices that you see in Safeway and CVS and Target and all that. So although I think Boca and Risewell may be available in Target. So it's happening. It's changing. I mean, the options are more available. Yes, they are more expensive, but I would argue that in the long run, it's less expensive. Your dental bills will be much less, and you'll be happier. So yeah. So I liked Boca more than I did Risewell, but my grandchildren used Risewell because they liked the flavors. I really liked the flavoring that James did in the beginning, very unique flavors. And I do not like an overpowering, burning mint spearmint. I mean, I guess I'm sensitive to that. I mean, we have a mild mint flavor. It's just a hint of mint. It tastes like food. It's I live here in wine country in Napa Valley, and everyone's talking about the nuances of the vegetables and the sauce on your plate and how it goes well with wine, and there are flavor wheels that are available underneath your placemat. I mean, just the nuances and the complexity of things, and that should be available in toothpaste. I really do. I really do think that, because this is something you do twice a day. I actually look forward to using toothpaste. That's important. I look forward to using floss after I started using the Slate flosser. To make a habit stick, it has to be enjoyable, right? So the big toothpaste companies, how can that be palatable? I don't get it. It burns. It makes you wrinkle up your face. You want to spit it out. You want to rinse out right afterwards. Again, you don't want to rinse with a hydroxyapatite toothpaste. You can spit out. I actually swish a little bit. I think toothpaste should be less thick than what we typically get. Again, it's reverse engineered saliva. It should be very viscous. By the time you've done brushing for 2 minutes, it should be very viscous. I walk around the room and I swish with it. And then I spit it out, but I do not rinse with water. As I said, at night, I put in my appliance because I want that hydroxyapatite in place as long as possible. With fluoride, you shouldn't be using fluoridated toothpaste, but if you are, spit it out right away. Rinse out your mouth. Get rid of that stuff. I mean, anyway, it's the toothpaste market is changing, and I'm very, very excited to be part of it on many different ends, supporting other brands and getting the word out that we need to do this 180-degree turn. It's time.
Let's move into floss. You've mentioned the Slate flosser, and before you also mentioned Silk. And I think when you mentioned that one, you said it's a little bit tricky to use. Talk about how you incorporate both of those into your routine.
So before Slate came out, again, from day one, I've been very concerned about floss and nylon particles breaking off. This goes back 25 years ago. And I'm not sure, I mean, as a dentist, you're always wearing loupes. We floss patients' teeth. I floss my own teeth. I would see little fragments break off. In the old days, we used to see little micro beads in patients' gums. Again, I'm wearing a 4.6x magnification surgical telescope on all my patients. And it's amazing what you can see. And again, you can't treat what you can't see, but we would literally, my hygienist would see it as well. We would see these little red microbeads. They're tiny, almost invisible to the naked eye. They were putting that into toothpaste to make it sparkle. It's not quite a microplastic, but it's between a microplastic and a chunk of plastic. And this has now been outlawed in California, thank goodness, but just for looks. So there are a lot of things that show up that we can see if we have magnification. Strands of floss, chunks of floss would break off. Where does that go? The body has to wall it off. Sometimes you can have a foreign body reaction. I've seen that where someone comes in. I typically can recognize it just by talking to a patient on the phone. It's usually a piece of popcorn, the hull of a popcorn, just based on the questions I ask. How quickly did it come up, the pain? Was it throbbing? Does it get worse when you lie down? Does it feel better when you floss it just for a few minutes? That is a foreign body reaction due to a foreign particle that is not dissolving, and the body overreacts and sends all the blood to that area. And if it's a popcorn kernel, you tie a double knot into floss and you drag it through there a few times. The hull comes out and the pain is gone almost immediately. If it's a piece of plastic from a toothbrush or floss, that's more difficult. The body freaks out when it sees that, and that has to be fished out. I have fished out small pieces of plastic, and they're more difficult to see. The Teflon floss, which I liked in the beginning 30 years ago when it came out, I thought, oh, this is brilliant. It was Gore-Tex. Gore-Tex came out with the product. They used the PFTE. It's a Teflon-based product. They sold it to Oral-B, I think, Procter & Gamble. And you don't want to be using Teflon. Small pieces do break off, and you're ingesting that beyond microplastics and microbeads. And then just pure nylon floss is a problem. The Slate flosser uses a PFAS-free floss. Those are good. I've looked into it. Very inert and durable, so you can use it many, many times. If you really are paranoid and you want to, paranoid in the good sense, I'm not saying in a bad way, and you really are working on being clean and trying to avoid every single contamination, use the Radius floss. Again, I mentioned the Radius toothbrush. This is a natural product. It is made by silkworms, and it's biodegradable. The case, unfortunately, isn't. I wish it didn't come in a plastic case. It should come in like a paper, waxy paper case that will break down in landfills. But if something breaks off, it's a protein. It's silk. There's no foreign body reaction. So is it more difficult to use than a Teflon floss? Yes. Flossing is a very difficult thing to do for patients. It takes a lot of dexterity and coordination, and it can be painful and uncomfortable. And a lot of people have floss phobias. That's why the Teflon floss is good. I mean, it works for people. So Radius floss is more difficult to use. I would argue that the Slate flosser is the best thing out there right now, even though it's not silk, because it's easy to use. It's really a game changer. It's more than floss. It has these patented little hairy silicone gum sweeps. It really cleans well, and it vibrates at 12,000 cycles per minute. It was invented by a dentist up in Washington, Dr. Snyder. I just have to hand it to him. I wish I had thought of it. It is really an amazing device. It is one of the great big leaps in oral hygiene care for home care. Again, it's plastic. It has batteries in it. I understand that, but if you have oral disease, this is something you need to get on. And theoretically, it could last a long time. The batteries come out, and you can recycle your batteries, so it doesn't have a rechargeable battery, which I like. And the batteries last for months. But the design of it is amazing. And again, I'm not associated with him. I don't own any portion of his company, but I just like it so much and we use it at home. Everyone in the family uses it, and we love it. My go-to was a floss stick, unfortunately made by Listerine company, but it helped a lot of people because people can't wrap floss around or they're not willing to put their fingers in their mouth. They find it difficult. A floss stick is a great way to go, and there's nothing wrong with using a floss stick. This takes it one step further. The Slate flosser. It's a rigid, bigger circumference handle. The head doesn't flex, and it really those gum sweeps it's more than just flossing. So use the Slate first, then use an electric toothbrush. Use nano-hydroxyapatite toothpaste. You're really gaming the system that way in a great healthy way.
You've got me convinced. How long have you been using the Slate instrument?
It's been about 4 months, and I really stay excited about things, and I've got 2 of them, and my wife has one. She is just bonkers about it. She is the oral hygiene queen, always has been, and she can't even look at floss. It's like if she's got to have this nearby. And when we get low on the little replacement head, she gets very nervous. She needs to have like 100 in the cupboard behind us. Anything below 100 is too low.
So we know for you, before you go to bed, you put the toothpaste on your teeth, spit out, but don't rinse. And then you put your appliance in for your sleep apnea.
Yep.
Tape your mouth.
Mm-hmm.
And just to clarify those 2 different things there before sleep, I think even for a while I was confused. I thought the sleep tape help with sleep apnea, but you explained earlier that's to help with saliva during the night.
Well, it can help with sleep apnea. That's a whole different category. And that was how I originally got onto sleep tape, because to me, it was a differential diagnostic tool. It was very difficult. Once I got my dental sleep medicine training, I really wanted to cut to the chase. And so when I asked my typical middle-aged male patient, do you snore? And the answer was always, no, I don't snore. My wife does, but and then I got the real story from the wife. It's like, oh my God, he's a, and I could tell that there was a sleep disorder breathing issue based on other things. Dentists can see sleep apnea decades before a physician can, because we're looking at different things. We're trained differently. But it was a way to convince the patient that they had a breathing disorder. And it started off with the snoring. So if there were, I mean, in a nutshell, if the tape stays on and it's on in the morning and they slept better, that means they were forcing all the air through their nose. That helped them greatly. Sympathetic tone, parasympathetic tone. Obviously, it helps with oral hygiene and the oral microbiome, but that's a different category. If the tape was still on, but they tossed and turned a lot, that means they were compliant. They could keep the tape on, but they couldn't get enough air through their nose to sleep properly. They were suffering from a little hypoxia. They were overbreathing CO2, et cetera. And if the tape comes off, obviously you can't breathe through your nose. And that is related intimately with sleep disorder breathing. So for me, it was a tool. But then later it became something that patients were like, oh my God, this is wonderful. I finally convinced my husband to mouth tape. The snoring went away, or they started feeling better. It's not a cure for sleep apnea. But it's a great diagnostic tool. And for borderline cases, maybe upper airway resistance syndrome, and even for people that don't have sleep apnea, it's better to secure the mouth, close it. And again, why not? There are so many benefits to breathing through your nose from the cavity and gum disease perspective and oral microbiome, but also from a sense of well-being, deeper sleep, lowering your respiratory rate. This is all measurable, by the way, from an Oura ring. Oura ring is sensitive enough to pick up between not mouth taping and mouth taping, mouth breathing, nose breathing. But why not take advantage of that wonderful wellness of being able to breathe through your nose for the 7 to 8 hours that you're just sitting there doing nothing, right? That's what mouth taping really is. Everyone should mouth tape. I mouth tape, even though my mouth stays closed, I think, but I don't want to take that chance. I want to force all that air in and out so my CO2, O2 levels are perfect and my HRV levels go up, my respiratory rate drops, my resting heart rate drops when I mouth tape. And I can breathe through my nose just fine.
What I'm trying to tease out, though, is the difference between that appliance and the mouth tape, which you're doing both. So, mouth taping, what I'm gathering here, for people that might have a bit of snoring or their breathing is slightly distorted, this might be enough for them. And you've mentioned, and I know in your book you talk about the fact that you have mild sleep apnea. So you need this other layer, this actual mechanical thing that goes over your teeth and holds your jaw forward as you're sleeping as well.
Exactly. And so I need that device. And as I get older, I'll probably rely more on it. I've just recently lost 15 pounds. I think that helped because your tongue can gain weight, your airway can gain weight and can become more constricted. But again, as you get older, the tone of the airway it doesn't get any better. But there are cases, borderline cases, where if you can redirect the air that goes in and out and steer it through the nose is a baffle. It slows things down. It slows down the velocity of air that goes past the airway and back out. It humidifies the air in such a way, and so much so, that baffle, that restriction, and also changing the CO2 O2 mix so that your breathing rate drops. All of that makes it less likely for the airway to collapse. And once it does collapse and your mouth breathing and your mouth is very dry and saliva flow is down, when those two sides of the airway stick together, they're going to stay stuck together until you break them apart with an apnea, with a sudden awakening or an arousal. And so moistening the air, slowing it down with a borderline case for someone that is just a a light snorer, and then when they do start snoring and the mouth falls open, the airway gets sticky, breathing rate is higher, respiratory rate is higher. There are cases where that is the cure. Now, I'm not asking patients to be determining that on their own. Get a sleep study, get an Oura ring, track your sleep, and if your sleep partner says you're snoring, deal with it right away. It's not funny, it's not cute. It is a sign of a narrowing airway. And there's actually a great product out of Toronto. I think it's Toronto. Yes, it is Toronto, called Nora. Nora. And I'm going to put them on my store soon. Haven't gotten around to it yet, but it's a device that I tried, and I took out my oral appliance, and it's a little air bladder. All the devices are far away by a plug, 6 feet away from the bed. There's just a plastic tube and a little microphone by the bed. And when it hears you snore, it fills up the air bladder that's inserted into your pillow, and it changes the positioning of your head. And that's enough where instead of going into a full apnea or staying in a state where you're having long apneas, in other words, you're not breathing for 30, 45, 50 seconds, this readjusts you quickly and subtly. And for certain patients, this is wonderful. It really works well. And so that's a device that I'm going to be recommending soon. And that is available in Canada, by the way, all of North America. I think it's available all over. But so I know what you're trying to do. And everyone's looking for that absolute, like, should I tape? Should I do this? And again, it's multifactorial. Find someone on your team. I would argue that it should be a dentist, a sleep-trained dentist. Physicians are a little obtuse on this based on their training. No offense. And we can see it sooner, so we can treat it earlier, so that you don't gain all the weight and get all the comorbidities of sleep apnea that come over time with, not breathing properly, suffering from sleep disorder breathing, and having an AHI of 5, 10, 15, 74 interruptions per minute of waking up and suffering and brain fog and all of that, brain damage. Get someone on your team that can address this in its early stages and talk about things like Nora or mouth taping. And again, if you're not sleeping well, you're going to wake up with this huge appetite. Your leptin and ghrelin hormones are affected. These are the same hormones that they're playing with these weight loss medications. You're gonna gain weight, and you're gonna look for energy because you're tired, the brain fog, in very fermentable carbohydrates, junk food, breads, crackers, snacks, sugar, sweetened beverages, all of that. So don't start down that road. I wish I had caught my sleep apnea earlier. I talk about that in the book, but I didn't know.
The other
And
device
most of us don't know.
I saw on your website was this suction cup for your tongue.
Yes.
How does that compare to I've seen your device in a video that actually goes over the teeth and holds the bottom jaw out.
Yep.
Is the suction cup of the tongue, does that do something similar? Obviously, it's a different mechanical way of holding things, but does it have a similar end result?
That's a great question. The quick answer is no, but that's called the TRD, the tongue retention device. And I like those. I would have them stocked in my office. The one I chose to stock was out of Canada, actually. It came in 2 different sizes. And so what my device does, it's rigid. It has these McPherson strut rigid devices. They're telescopic things that I can move my chin forward. I can stretch open. But when I go to relax, when I let go of the chin, the jaw will fall back, especially as you go into deep sleep, the muscles relax. The struts, bind or bang into each other. I mean, they're fixed in length. They're adjustable side to side and in telescopic length, and that prevents the jaw from falling back. If the jaw doesn't fall back, then the tongue is in a forward position. When you go into deep sleep, the tongue will roll up into a little ball. It's very complicated. Many people have different tone and different positioning of the tongue. They have different muscle memory. This is all the myofunctional aspect of things. And the tongue can gain weight as well. It can marble ice and fat. It can get bigger. It can block the airway. But by holding the jaw forward, and this is not for everyone. Again, I would screen my patients by sending them to an ENT, sending a camera down their throat, doing a modified Mueller's maneuver. That's in the book. And I would want to see the difference based on the camera and the ENT. I actually had to train him to do this. It's a Mueller's maneuver, which is what they do, but then it's modified for the sake of a dentist. So they would look at the airway, but then I would want to see the airway with the chin supported and the chin all the way back. I would want those two extremes compared, and he would give me a percentage in the three different zones: nasolaryngeal, pharynx, and so knowing where the blockage is and how much of a difference there is between being fully protruded and fully retruded gave me a sense that I was always working on the right patient, case selection. And 99% of the time it worked. If you don't do that kind of pre-selection, then it may only work 66% of the time. These are numbers that you see in studies. So it's not for everyone, and there are some side effects sometimes, but the TRD is a great way to get the tongue out of the way. The jaw can still fall back, but when you place this, it's got a soft silicone flange that sits between the lips and the teeth. So it's held in place. It's like a shield. There's an airway through it. You can still breathe through it if you want. And then there's a bulb that goes inside the mouth with an opening in it. And if you force your tongue in there and push out all the air, it's a suction cup, and then your tongue is caught in this forward position. Ideally, it should be up on the roof of your mouth. But for those people where the tongue curls up and balls up and goes to the back of the nasopharynx or lower, velopharynx, then that's a good thing. That could also make a difference. And it's cheap. I mean, they cost nothing. You can get them on Amazon, I think, for $30. I mean, I would always do it in conjunction with a provider, but if you're willing to try it, and then make sure you're tracking that. There are simple apps that just listen to your snoring. Does it affect your snoring? If the snoring goes away with a TRD, you have accomplished something. You're less likely to have apneas. Again, verify that with a sleep study. An Oura ring is a great way to measure sleep. You're going to get more deep sleep. Typically, people will drop into deep sleep, but then the Oura ring will show you this in a graph. How long is that bottom blue bar? In other words, you want it to be as wide as possible up to a point, because the body will get you out of there naturally, out of that deep sleep. But if it's just a little blip and then you bounce out of it and then you bounce back into it, those are all apneas. You're trying to get into deep sleep, but once you're in deep sleep, these muscles and REM, different type of deep sleep, all these muscles let go, and then you can't breathe, and and then you wake up, and that's an apnea. So you can see all this represented. It's like a stage play. It's like a Broadway show. There's certain things you need to see in terms of timing and all that. And by the way, the biggest, just want to throw this in there, something I've learned over time. I talked about it in the book, but I didn't really emphasize it as much as I wish I had. Probably the most important thing, other than getting a sleep study and verifying your ability to breathe through your airway, nose breathing, mouth breathing, all of that, that's the anatomical portion of a puzzle piece in sleep apnea. But in terms of lifestyle and hacks and sleep hacks, the biggest one by far is going to bed within minutes of the same time every night and waking up. I would wake up naturally, but what will happen is that if you go to bed within the same minute, I mean, set an alarm to go to bed and make sure you're in bed. We try for 9:45, and we're pretty good on that. And I typically wake up wide awake to where I can't go back to sleep within minutes of the same time. That's without an alarm clock. It could still be dark. Right now, it's because of daylight savings, it's very dark. And that is your body. That's your circadian rhythm. Your circadian rhythm is quite strong if you let it be that way. But if you don't go to bed and you've been blinded by blue light and you go to bed late, you're not going to be able to catch up on any sleep because you've missed that first stage of deep sleep and even REM later. But it's staging. It's all about staging. So that is the biggest sleep hack, I think. Going to bed within minutes of the same time every single night. And if you do make a change, make it slowly over a period of 2 to 6 weeks. And again, that's why everyone gets crazy during daylight savings time. I mean, car accident rates go up, death rates, industrial accidents, all of that. People get tired. That 1 hour makes a huge difference. It's big. Even 10 minutes makes a difference.
You've brought up Oura Ring a few times. and you brought up a sleep study. I'm a big fan of Oura Ring as well. Is that technology now at a place where it replaces an actual sleep study, going in and getting all the wires hooked up and going through the whole rigmarole, or is there still more benefit you can get from doing a full-on sleep study?
That's a really important question to have an answer to. And I love the Oura Ring. I'm not associated with them in any way. Um, um, and I'm on my third version, and the software is getting better. The algorithm is getting better. It's a great company. They take it very seriously. They have studies that compare their study. Essentially, that's what it is. It's a sleep study every night on your ring that they're doing. And they compare their study to a PSG, which is the gold standard, the polysomnography, which is where you go into an office, like a clinic. It's not a hospital, typically, and they observe you. And they do, as you said, hook you up to a wiring harness from your chest to your feet to brainwave patterns, your head, scalp, and then they measure you. And they do get a lot of data from that. And the data that Oura Ring is not getting are the brainwave patterns. And so Oura Ring claims that they're within 97% of a PSG. I would argue that 3% that they haven't matched is probably some very important data, brainwave patterns. And maybe they're working on that. I love their product and I recommend it to everyone. But if you've never had a PSG, let's say if your sleep scores are 95 and higher and your readiness scores are excellent and all that, you probably have nothing to worry about. And if you're not snoring and you've verified that, you're mouth taping, you're healthy overall. If you feel like taking a nap during the day, that's not normal. I'm 65 years old. I don't nap anymore. I used to nap a lot because it was there and I would just give into it and I would nap for 10 minutes. I napped on the side of a glacier, locked in with crampons and an ice axe on Mount Shasta because I was tired and I napped for 10, 12 minutes, felt great, and kept climbing. I mean, that was my norm. And I was healthy. I was climbing mountains and skiing and mountain biking and doing 8-day traverses above tree line in the Sierras in the middle of the winter. I mean, these are all very demanding things, but I was always tired, sleepy tired. That's gone. Going from 12 apneas per minute, which is considered to be mild, moderate, and severe, to 0 apneas based on many PSGs. And I had a lot of them because I helped develop a product that was later bought by Google and worked on their algorithm. It was a new way of measuring sleep, touchless. And so we were comparing that technology to PSG. So I was being wired up a lot. So I've had a lot of these attended sleep studies. And it's still an important study to get. You can still garner a lot of data from it. And again, Oura Ring is great. It's something that you should be looking at every night, every morning. My wife and I compare results. We say, "Hi, honey. Good morning. How'd you sleep?" And we'll compare scores. And that's kind of our morning routine. And if someone didn't sleep well, did I snore last night? Did I keep you up, and vice versa? And was the temperature wrong? Are we using the wrong comforters for the season? All those things. This is important. And did we go to bed too late? When we're streaming TV and that time comes and we're in the middle of a show, we're good. It goes off and we go upstairs, we turn on our red lights, brush our teeth, and we go to bed. This is probably the most important health modification, behaviorally speaking, that we have made in our lives. And we were both very healthy to begin with, but evidently not as healthy as we thought. And this really took it up a bunch of notches. So I would say and again, I say this in the book, and I know it's a little unrealistic, but I put it in there just to be a radical and get the ball moving. And I think they do this in Iceland and Italy. I spoke to someone in Iceland. Everyone should get a sleep study at a young age, get a baseline. And I treat a lot of infants for sleep. We can catch it way back then. Physicians aren't doing that, of course, even pediatric. Maybe a pediatric ENT with a lot of good continuing education is catching it, but they're not getting the referral from the general. it has to pass. It has to go from a dentist or a general physician to get to that person. So there's that threshold or that kind of firewall, which is not good. But everyone should have a sleep study at some point in time. If you haven't had one, get one. The problem is getting one and getting your insurance to pay for it. Because if you're not sick and you're thin and you don't complain about napping and all that, and you read the book, you read it twice, and you know that in my book I said, here's the Epworth test they're going to give you. It's a written test. Just fail it. This is how you fail it. Get an 11 or higher on it and tell them you fall asleep at the wheel when you're picking up the grandkids or the kids. Get that PSG. And again, they're incentivizing managed care, medical care, to not do that test. It costs a lot of money. I actually set up a system in my area, in the Silicon Valley, where if patients didn't have insurance, I had a way, first of all, I had a way of porting that patient directly to the sleep study. I bypassed the primary care physician. I did it legally, and I worked with the owner of the clinic, who was a very Dartmouth-trained sleep physician, and he listened to what my issue was. I was seeing a lot of sleep apnea, but they were always getting bounced back. And then 10 years later, they would be like, I have sleep apnea. And the physician recognizes it. But it was too late. I mean, not too late. It's never too late. But it was unnecessarily late because they were suffering at that point. They had gained weight or had AFib or something. But and we worked out a system where I would fill out the form that he would fill out, give to the insurance plan, but I wouldn't sign it. I would give it to him. He trusted me enough, and after 2 to 6 months, he realized that I was batting like 970, 980, and I'm convinced those other cases were so borderline that they were hard to pick up, and we kept after him. But and then they would get the sleep study, insurance would pay for it, and again, that was the only way they could get it because these were healthy individuals. They were like me; they were thin and healthy, and or kids. They really push back on kids because they think they're just going to grow out of it. So that worked well, but then I negotiated a cash price. It was down to $1,100. So normally, insurance companies pay about between $3,000 and $5,000 for that sleep attended study. The attended sleep study. I got them down to a cash price of $1,100. So for those people that didn't have insurance, they could get that sleep study. So sleep studies are important still. To answer your question, I think everyone should check in every decade if they're healthy, obviously more frequently than that. In other words, if your dentist is making that device for you and he thinks he's done, go get tested again and verify that that device is working. If you're mouth taping and you think you're better and that your sleep apnea is cured, which is doubtful, depending on what level of sleep apnea you have, verify that. Don't rely on the Oura Ring. Look at those brainwave patterns, get a PSG, get some good data. It's important.
Got it. We'll end on this. So you get your sleep study done. Everybody ideally should be taping their mouth. There's different benefits they're going to get, whether or not they have sleep issues. And then we've talked about the one that holds the mandible forward, the device that you use, the one that suctions the tongue. The common one is the CPAP machine, which uses air.
Right.
Is there any other devices people are using if they have sleep apnea?
The Nora device, if you have a full-on diagnosis of sleep apnea, I wouldn't. You could still use it along with other aids. There's a lot of hybrid approaches or combination approaches. Like what worked well for me are I had a patient who had a AHI of 74. Little old lady, delightful, great sense of humor. Dead tired, right? Had lots of heart disease issues. She was in her 70s. She had an AHI of 74. That's 74. That's more than, 74 times a minute she was waking up. Imagine someone waking you up that often. She wasn't getting any sleep. The doctors gave up on her. She couldn't wear her CPAP. There's no CPAP that would actually fix that. You'd have to blow her up like a balloon to prevent those apneas. She wanted her son was the CEO and he healthy guy had mild sleep apnea and he said, "Oh, my mom's going to come in to see you. You can cure her." And I couldn't, but I made a deal with her and I had her sign the chart. I said, "Listen, if I can get you down with an oral appliance, it won't fix you completely. It won't get you to 0 or below 5 because you're just too far along and your airway is just too narrow. then will you try the CPAP again? And actually, I told her about an APAP, which is a more modern, has better feedback, is better than a CPAP. And she says, sure, I'll do it. So it took us about 3 months. I made her the device, titrated it, adjusted it. And I said, listen, it's time for a sleep study. This is the best I can do. And she was protruded. She was able to wear it and put it in. And, it requires a lot of patient management and help and all that. But she did really, really well. She was very motivated. And so she did the sleep study. We got it down to 19 apneas, which is a complete failure in dental sleep medicine. It should be 5 or less. But we got her down to 19. And I said, listen, 19 is pretty good. In fact, I'm surprised. I was hoping for mid-20s. Now it's time to try the APAP. So we got her the APAP. I directed her to a different CPAP provider. These are the sleep technicians. There's some that just throw it at you and say you're on your own, but there's some that are really work with the people. And she got onto the APAP, and now she has an apnea with the two together. She has to wear the oral appliance, but the APAP is working for several reasons. One is that the airway is already open, so the pressure is way lower. Again, an APAP or a CPAP blows you up like a balloon. It pushes air past the constricting airway. With the positive pressure, it balloons up your airway and keeps that pressure, assuming your mouth is closed. You have to mouth tape sometimes with an APAP and CPAP. That's a different story. And that positive pressure keeps the airway open and you can sleep better. So the two together, again, every person's different. But so there are many different therapies. A CPAP alone has very low compliance. After 1 year, only 30% of people can stay on the CPAP. And typically those people are forgotten by the medical system. They're like, oh, we've done everything we can. You got to wear it. And the patient doesn't wear it. And then they go in next year for another test. And have you been wearing it? I've tried. They haven't. If you're a pilot in Europe or a heavy machinery operator, your CPAP is wirelessly sending information to your provider, making sure that you're wearing it. It's like a breathalyzer, right? It's verifying that you're doing that. And I think that's great. The pilots union here in the US has not allowed that. They're against that. CPAPs are not comfortable. They have a lot of side effects. They're blowing a lot of air in you. People that wear CPAPs have a higher decay rate. There's a lot of dry air in there. The humidifier may not work. It's uncomfortable. It leaves marks on your face. It prevents you from moving around, although you shouldn't be moving around if you're in deep sleep. So that is, again, something that was developed in the 60s. I think it was here at Stanford. And it's not perfect. But there are a lot of things. There's a lot of hybrid options that if you do a little bit of this, a little bit of that, and the person, whether it's a dentist, a dentist, physician team working together, that can be fixed. And again, every person's different, but it's something you really need to fix. It is life-changing if you can get deep sleep and REM and sleep well. You're a different person, and your destiny, your whole life, it'll be two different paths, remarkably different from each other if you are getting good, deep, restorative sleep.
All right. Well, important we went deep into that. We covered a wide range here. Congrats again on the new toothpaste. We're going to link everything up in the show notes, the toothpaste, your book, your social media. Dr. B, really appreciate round 2. This was great. I'm sure we'll do it again. Thank you.
Absolutely. If there's a round 3 in the future, I'm in. Please count me in. And Jesse, congratulations on your podcast. It's you've got some great names, and I learn a lot just from listening to a lot of the people you interview. So good luck, and thank you for having me on again, Jesse. Thanks.
Dr. B emphasizes the importance of the oral microbiome. Stick around here for my chat with Dr. Davis. He goes deep into the gut microbiome. You don't want to miss this. I'll see you over there.
It would be hard, Jesse, to find diseases, modern diseases, that are not either initiated or exacerbated by the microbiome. Look what we're doing with rotarite.